Okay, here is the skinned horse head. And looking at some of the more superficial structures, one of the first things that you notice here is our facial nerve coming across the masseter muscle here. Both dorsal and ventral branches are here together, and they're dividing out down here into dorsal ventral branches there. Some specimens you'll see two separate pieces coming side by side up here. This one just has them in one. You'll see examples in your dissection guide of each of those patterns in the drawings that they have. So facial nerve, cranial nerve number 7 right there. Here's our parotid salivary gland, back here caudal to the masseter muscle. Slide this forward here. Zoom in a bit. Here comes our external jugular vein here, and that was formed by the confluence of our linguofacial vein and our maxillary vein here. They come together there. This is all still parotid salivary gland. In the dog, inside this venous angle, this is where the mandibular salivary gland sat in the dog. A nice little oval structure. But in the horse, the mandibular salivary gland is actually deeper down. It's back here in a long arcing shape. Okay, if I lift up that parotid salivary gland here and look underneath it, there's a mandibular salivary gland down in there. The big long structure right there. A lot deeper than it was in the dog. Okay, there's another area called Viborg's triangle. What that is a triangular shape formed by the caudal border of the mandible. The linguofacial vein as it came across here, this one's not intact. And then the tendon of your sternoclephalus muscle. Here's our sternoclephalus right here. There's a triangular shape right there called Viborg's triangle. This space right in here. When the guttural pouch is distended, it will distend caudally and ventrally into that area, and you can approach it through this triangle here and clean it out, do whatever needs to be done to it without damaging any structures that are important to the horse. So right between this tendon, the angle of the mandible, and then our linguofacial vein that is broken right here. Right there. There is the triangle. Now if we come down here and look just in front of our masseter muscle, there's a triad of structures here. The facial artery is the farthest rostral, the facial vein behind that, and the parotid salivary gland duct is closest to the masseter muscle, the farthest caudal. Those three things come around the front of the masseter muscle in this location. The artery came around from the medial side around that notch for the facial vessels that exists in the mandible. Parotid salivary gland duct was running right through here, where it would have connected up to the parotid salivary gland there. The facial vein comes off the linguofacial vein that was over here feeding into our external jugular. And if I lift this up, the linguofacial will stop here, and there should be the facial coming up and lingual diving down, and I believe that's what we have right there. Let's search for it. There goes the lingual vein down into the tongue there. Facial vein there, linguofacial back here. Lingual vein, that little small one there. That little lymph node right in front of that linguofacial, right in front of the lingual vein, those are our mandibular lymph nodes right there, that little cluster right there. So mandibular lymph nodes are these structures right here. In the angle of the mandible, just like they were in the dog. Okay, I've mentioned here's the masseter muscle here, one of the muscles that closes the mouth. Another muscle closing the mouth is the temporalis, right up here. We will not look for the medial pterygoid muscles on the horse. So the third muscle of mastication that we saw in the dog is the digastricus muscle right here on the back side of the mandible, and that will open the mouth. So there's the one that opens it. Those other two we talked about, masseter and temporalis up here, they will close the mouth. Okay, if we come down here to the lower jaw of this horse, when we were talking about the mental nerve coming off the mental foramen of the mandible, what you will actually do on a live animal is this muscle here is one of the facial muscles of facial expression innervated by the facial nerve. You will actually take that, it's the depressor labii inferioris muscle. You will push it up with your finger like this in the live animal and start palpating for that nerve up underneath it. And if you look right there, there is our mental nerve coming out of the mental foramen at this point here. So there's the mental nerve coming out of the mental foramen right there, and that's where you would block it. Blocking that infraorbital nerve up here, we have elevator labii superioris. Levator nasolabialis is off. It was a thinner muscle laying right over here, and you will push those up and palpate back to feel for that lip of your infraorbital foramen, and right in there is where you find that nerve, and there it is. There's your nerve coming out the infraorbital foramen. It's extremely large. So once again, when you palpate for that, you will put your hands on the skin of the animal, push that muscle up out of the way, and palpate back to locate that foramen. Okay, looking at our horse head again here, if I look up at the base of that zygomatic process of the frontal bone, you can see our supraorbital nerve exiting that supraorbital foramen right there. So there is that nerve where you'd block sensation to the upper eyelid. There's our supraorbital foramen right there.